Navigating the playing field of Medicare Advantage. Stay tuned for more information on understanding the significance of the impact of Medicare Advantage on home health agencies. What is Medicare Advantage? Medicare Advantage plans are typically referred to as Medicare Part C or MA plans. Medicare Advantage plans are run by private companies funded by the Medicare benefit, but administered by these private organizations referred to as Medicare Advantage organizations or MAOs. The Medicare Advantage plans can be selected by any beneficiary who is age 65 or older and meets the specific requirements of being eligible for both Medicare Part A and Medicare Part B. When selecting a Medicare Part C plan, these beneficiaries are to receive the exact same coverage they would receive under the Medicare Part A and Part B benefits. When determining their time frame for enrolling in Medicare Advantage, it is upon their 65th birthday, and there are times that they can change their plan or go back to original Medicare during the open enrollment period, October 30th through December 7th, and there are special enrollment periods in which the patient may also change their plans throughout the year that have very specific criteria in order for them to do so. When asking yourself where Medicare Advantage plans are active in the nation, it's very important to understand how that coverage area impacts your agency specifically. Approximately 43 plans are available to every Medicare beneficiary to select from. Most beneficiaries live in an area where at least 60% of the beneficiaries in the county are Medicare Advantage participants. 51% of total Medicare beneficiaries are currently enrolled in a Medicare Advantage plan. Agencies should make the decisions about contracting with Medicare Advantage plans based in part on the saturation of Medicare Advantage plans in their area. When discussing the coverage that the Medicare Advantage plans are required to provide, the regulation states that Medicare Advantage plans are to provide the same coverage that traditional Medicare Part A and Part B should be supplying. Many home health agencies would agree that this is not the case in actuality. The home health agencies are required to obtain prior authorization from most Medicare Advantage plans prior to providing services, and many times the authorization of visits is for many less visits than the agency would have provided had they been an original Medicare patient. That being the case, patient quality of care outcomes suffer in many cases. When home health agencies are considering whether to contract with a Medicare Advantage plans, there are many things that should be considered. The agency should definitely consider the saturation that the Medicare Advantage plan has in their area. On that same note, agencies should consider how many referrals they have received from specific Medicare Advantage plans and how many they might have had to refuse because they were not contracted with those Medicare Advantage plans. Agencies should also consider whether other agencies in their area have contracts with those Medicare Advantage plans and what those relationships might look like. Agencies should also compare one Medicare Advantage plan to another, especially if it comes down to the decision of one of them versus the other when you're determining how many contracts you want or need to sign. Obviously, the biggest question is, which contracts can my agency sign to be the most beneficial to both my agency and my patient's care? Some of the key elements to consider when reviewing the content of a contract from a Medicare Advantage plan include all the terms of that contract, which might include the timeline for renewing the contract, the timeline by which you can renegotiate rates for the contract, the outline of the billing processes, access to provider manuals, what the authorization process looks like, and many more. The content of a contract should be considered and reviewed in detail, and the only element of consideration should not be the reimbursement amount. There are so many more aspects of implementing a contract effectively, and everyone within your organization that will be a part of the process in eventually getting your patient care provided and your payment received should be a part of the review of the contract and making the decision as to whether or not to engage with specific Medicare Advantage plans. The hardcore reality of our situation is that home health agencies are no longer in a situation where 80% of our patients are original Medicare beneficiaries. Home health agencies must focus on how we can continue to thrive in a Medicare Advantage world. Medicare Advantage plans can be very difficult to maneuver, and the implementation of those plans and contracts even more significant. Healthcare Provider Solutions is here to assist in any way necessary in the implementation of new Medicare Advantage contracts that your agency might engage with.